Hi everyone. Today I'm going to talk about COVID-19 vaccines and the recent news about dermal fillers and its potential for complications. My name is Ann Lee. I'm a practicing physician assistant in dermatology since 2006, and I work in Beverly Hills and Glendale, California. Since the middle of December 2020, with the recent emergency authorization use for the Pfizer and Moderna vaccines, there's been a lot of talk about COVID-19 vaccines and its potential for complications in those who get dermal fillers. And so because of this, I've had several patients ask me whether it's safe to do dermal fillers during this time period if they're also thinking about getting the COVID-19 vaccines. Now, with the Moderna trials, which took place in 2020, there were 3 individuals out of 15,184 who reported lip swelling and facial swelling after getting the first or second injection of the Moderna vaccine. And these individuals were treated with oral antihistamines or oral cortisone, and their side effects went away. So they reported this facial swelling maybe after a day or 2 of the injection, and then they were treated, and then within 3 to 5 days, their symptoms completely resolved. And so there was no long-term side effects, and they did not have anything that they experienced after those 3 to 5 days. Now, because of this increased chance, the American Society of Dermatologic Surgery, they posted a guidance on January 7th of 2021, just letting people know that the mRNA vaccines, which include Pfizer and Moderna's vaccines, can lead some people to have an increased chance of complications if they've had dermal fillers in the past. Now, there has been evidence showing that dermal fillers can have side effects of swelling and tenderness if you've had a vaccine in the past, such as the flu vaccine or the pneumonia vaccine. And we've also seen that you can have facial swelling if you have a viral or bacterial infection that you're fighting. The same thing can happen if you are going through a dental procedure like a root canal or a really deep cleaning. Bacteria is dislodged from the tooth, and it goes into and under the gums, and it can travel to a nearby bloodstream, so you can have facial swelling for any of those reasons. Now, typically that swelling does go away, and most of the time there is no need to get treatment. But if you're someone who's very sensitive and this happens to you every time you get a injection of a dermal filler, then you will probably need to get some oral antihistamines. Now, a lot of my patients ask if they've had filler in the past, if it's safe for them to get the vaccine. And I tell them, yes, it's safe to do the vaccine. Now, at this point in America, we've had over 11 million individuals get vaccinated, and the incidence of these facial swelling reports have been very low. So if you had dermal filler either 2 weeks ago or 2 years ago, it is safe to go ahead and get your vaccine. If you want to get the oral antihistamines because you're somebody who's very sensitive and tends to have swelling after the treatment, then that's what I would recommend that you do. But you do not have to avoid getting the vaccine. I think that it's definitely very safe to go ahead and do that. Now, if you've never had any dermal fillers in the past and you're thinking about getting the vaccine, go ahead and get vaccinated. Wait about 2 weeks after the second dosage of either the Pfizer or the Moderna vaccine, and then get your dermal filler. That will probably be the most safe, so you don't risk any possible potential complications. And then if you've had fillers in the past, you don't have to discourage yourself from getting vaccinated. So it's safe to go get it done. Yes, there's the potential, but I don't think that it's worth preventing yourself from getting the shots. Now, I've also had patients ask me, is it safe to get Botox or Dysport if I want to get vaccine? Yes, absolutely. Go get vaccinated. We don't see the incidence of complications from Botox and Dysport after the injections. There may be some swelling and tenderness the day of, but typically the next day it's all resolved. So we don't normally see the immune system kicking in the same way as we do with dermal fillers. So it's absolutely safe to go ahead and get Botox done either before or after your vaccine, and to proceed on your normal schedule. Now, if you have questions still and you're interested in getting some more information, feel free to message me, and you can either type a message on this Instagram, or you can call our office. And if you want to get an individual consultation, you can call us for an appointment to come in, or you can also do a virtual appointment with me. So either is fine. I'm happy to talk to you over the phone. And if you have any other thoughts or concerns, you reach out to me in the future. Otherwise, I see you next time, and looking forward to it. Bye-bye.